Hello and welcome back to Dudu's MD. I'm Falake Lawal, infectious disease, internal medicine, and your public health physician. This week, I'm going to be wrapping up the cardiovascular series of diseases with heart failure. Before we start, please make sure you subscribe to our channel and make sure you share this with your friends. Stay tuned. So heart failure is a state in which the heart is not able to function properly. Of course, that's what heart failure means. But what is that function? The primary function of the heart is to pump blood to all parts of the body and make sure that everywhere and everyone is supplied. So when you have heart failure, it means that there's a varying degree of inadequate blood supply because the pump, which is the heart, is not functioning properly. So that just simply means the heart is unable to pump enough blood to meet the demand. So it's a demand and supply issue. And your supply is not necessarily that your demand is high, but your supply just has a problem. So who does heart failure affect? Mostly it's elderly people who are above 60, the larger population above 60. There tends to be a slightly higher predominance in men. However, depending on the cause, because we have inherited causes also, or hereditary or genetic causes, you can also find heart failure in younger people. Worldwide, there are about 64 million people who have heart failure. And in a country like the United States, about 6.2 million people do have heart failure and are living with it. Now, if you look at that, of all the people, the 64 million people around the world, about 9.9 million years of life is lost to disability. It means that someone can say that the quality of my life after I had heart failure has reduced by 40%. Then you now take 40% of their life and compound that and do that for each person and add it up. So you have about 9 million, more than 9 million years lost to the disability that heart failure causes. And it's also very expensive because in the US, it actually costs, the economy, people, over $340 billion. So that's why this is important. It's not just about your health, but there's a lot of economics around. The causes of heart failure are many, and it's a spectrum. We've talked about a lot of them in the previous episodes on this batch, on this cardiovascular batch. But just to recap, we have coronary artery disease, which can lead to myocardial infarction. So your heart is not getting enough blood supply, it's starving, it's not able to work properly, and it can starve of blood up to the point where you have death of heart muscle. So when that area dies, it doesn't function properly. People who have heart failure, that's an rhythm problems, arrhythmia, right? Remember we said the heart is supposed to squeeze, boom, and push blood out. But when people have arrhythmias, the heart is shaking. It's like, am I gonna squeeze properly? No, I'm just gonna shake a little, shake a little, shake a little. So when you're shaking, the blood is not leaving the heart and it's not going anywhere. So that, especially in acute cases, can cause heart failure. The other cause, hypertension, is one cause, and we know that this is a silent killer all over. There's a lot of people that have heart failure, hypertension, and when hypertension is not managed properly, it can lead to a type of heart failure. We talked about arrhythmias, valvular heart disease also, because these are the doors that control the flow of blood, right? It's able to close when you need it to stop blood flowing, and it's able to open when you need blood to flow. So when you're not able to control that, the movement and the supply of the blood, is affected. There are other causes that we can put on like chemical and toxins, so drug use, cocaine, alcoholism, there's alcoholic cardiomyopathy. There's also some drug-induced cardiomyopathies that can happen. Infections, can damage the heart muscle to the point where it stops working properly. And then another thing is radiation. People who either, through work or just by accident are exposed to radiation, or people who have cancers and have to get radiation therapy, especially like chest or head and neck cancer. So those are some of the causes of heart failure. Heart failure can be classified into different types based on the side. Generally, there's the right side of the heart. You know, when you go back to the normal description of the heart that we did in our first series, there's a right side, there's the left side. And the right side, what it really does is receives blood from all parts of the body and sends blood to the lungs, okay? The left side of the heart receives blood from the lungs, oxygenated blood from the lungs, and then sends the blood to the rest of the body. So that's how you have that cycle. So you can have a right heart failure or left heart failure, or you can have biventricular, which is combined on both sides. And the symptoms tend to be similar, but sometimes there are subtle differences that helps us to be able to tell. So remember I said one sends blood to the heart, to the lungs, right? If you have a right heart failure, it means that you're not able to send enough blood to the heart, to the lungs, and that means you're not able to oxygenate blood properly, and that means that blood is backing up into the body. It's supposed to come from the body into the right side of the heart. If that cannot pump forward, what happens is you have a back flu, right? And then you start having leg swelling, abdomen, belly swelling, and things like that. For left side, one difference that can be easy is the blood is meant to leave the lungs, go into the left atrium, then from there go out into the rest of the body. If the left heart cannot pump blood out of the heart, there's back flow. It means that the blood leaving the lungs does not have room to go. It doesn't have anywhere to go. And that means that you now have backup of blood into the lungs, and these people tend to easily have what you call congestion. So you might have heard the word congestive heart failure. This just refers to the process where the lungs are congested with fluid. Many of us know, what it feels like for your nose to be congested, maybe in your throat. You can have it in your chest with fluid, and they manage it, they manage it in different ways. Biventricular, it just means both sides of the heart are damaged. What are the features of heart failure? Some of it I mentioned a little earlier. So usually the first thing is, or if you look at it, the blood is meant, the heart is meant to pump blood, and then you might have back flu and things. So one of the classical features is shortness of breath, which can flow into or from exercise intolerance, and that actually is one of the scales that helps us to grade what stage somebody is at. So exercise intolerance, activity intolerance, shortness of breath, either with activity or at rest, that's 1. 2 is because you're not able to pump and move blood properly, depending on where. You might have low oxygen levels, and this can lead to things like being fatigued, tired. It can cause confusion in some people, or just have some like mental fatigue. Another is because of the backflow of blood, or just not moving properly, you have retention, and people can have leg swelling, abdominal swelling. Sometimes you can also have cough when you have lung congestion, and this cough, many people describe it as frothy. It's like foamy cough because your lungs have too much blood, too much fluid. The blood a little bit can tinge it. So classically it's described as pink tinged frothy sputum when people cough, but cough is the predominant thing just because you have a lot of congestion in the chest. All right, so I did mention a little bit about trying to classify, because it has a severity. Some people can tell you, oh, I have heart failure, and they're up and about and being able to be active. So there's what we call the New York Heart Association functional classification, and the key word here is functional. It's basically how the person is able to function. So a person has their baseline, normal activity that they do, depending on what each person's tolerance is. Some people will say, oh, my normal activity is walking 5 miles a day, and some will just be like, oh, it's just walking 10 minutes a day. Whatever your normal activity is, if you get shortness of breath or whatever symptoms that are related to the heart failure with activities that are more than your normal, that is class 1. Okay, so class 1 is more than ordinary or more than your normal. Class 2 is symptoms with your ordinary or your normal set of activities. Class 3 is symptoms when you do minimal activities, which means, oh, maybe I'm able to walk up a flight of stairs. Now I can't even walk up 2 steps, and I'm, shortness of breath and all of that. I'm feeling very tired. That will be 3. 4 is having symptoms at rest. So it means you are not doing anything. You're just sitting down, needing very little, and your heart is still not able to meet up. So that is it. More than ordinary level activity, ordinary level of activity, minimal activity, and at rest. So those are the 4 classes in the New York Heart Association functional classification of heart failure. Management of heart failure, like I always say, everything starts with getting the right diagnosis and associated factors that you need to manage. So one of the first things, is you check a lot of blood tests, kidney function, liver function if you need to. But one thing, even blood counts, because sometimes there are conditions that mimic heart failure, but the person doesn't actually have heart failure, like anemia. It's just not enough oxygen, so it feels like your body's not pumping enough, but it's like your body's pumping, it's not carrying enough oxygen. Anyway, enough with that. So with management, one of the first things that you do is you want to find out what's going on and how bad things are. One of the specific tests for heart failure is what we call a natriuretic peptide, or BNP, brain natriuretic peptide. Forget about the brain, it can be confusing, but it's a natriuretic peptide that is secreted by the heart muscle when it is stretching, and the more it stretches, the more it releases, so the higher the number. And we use that number to actually track improvements, because when you're reducing the fluid and treating, the number tends to come down. Another, you want to see adjoining organs, so people do chest x-rays or CT scans to be able to look at the lungs, echocardiogram, which is like the ultrasound of the heart, to see the functioning of the heart. Is it beating properly? Is it all of it that's not beating properly? Is it some part that's not beating properly? And what is the ejection fraction? That also helps us to be able to make that determination. There's some other tests, depending, there may be a cardiac cath, but there are a lot of other higher level imaging that require radiation, that can help in making that diagnosis. And then when the diagnosis is made, it's sure what type of heart failure you have, also maybe what complications that may, like some people have heart failure and it causes lung problems also. So they're able to now map out a plan. Of course, in treating, there's medications, which many of it is diuresis, which is water pill or fluid pill that makes you pee out a lot of what we call excess water. They tell you to regulate your lifestyle, reduce salt intake, but there's also medications that modulate functioning of the heart. Either you don't want it to beat too much, you don't want it to beat too fast so that it doesn't tire out. And they've come up with this plan depending on, the type of heart failure the person has and the condition surrounding it. We've come to the end of heart failure discussion this week, and also for the cardiovascular diseases just series and group. If you have any questions, please make sure that you send them and let us know your comments. Next, we're going to be moving to respiratory diseases or pulmonary diseases. Please make sure you subscribe to our channel, share this video with your family and friends, like and follow us on our social media handles. Till next time, I am Falake Lawal.